We've been having a series of discussions about what's next in the workplace. And I'm excited to be here with Rex Miller and Dr. Jeff Jernigan for part 2 of our conversation about COVID-19 and the crisis in the workplace. Rex and Jeff have been studying the COVID-19 crisis and its impact on the workplace, and they put a book together, Return to Work, A Leader's Guide to Avoiding the Mental Health Crisis. And we've been discussing with them in a 3-part series the various aspects of getting back to work and restarting our economy. So the first session was looking at the COVID-19 crisis and some of the risks and challenges that we were experiencing with stress. So in this session, what we're going to talk about are the unique challenges and the brain health support needed for a work from home. So we're going to talk about the adoption from work from home strategies. And Rex, let me start out with you. What are you seeing from your clients with regard to working from home?
Well, initially, I saw great excitement at the efficiency and the continuity of moving from the workplace to remote. It was a big eye-opener for a lot of clients. Some old school clients that thought you couldn't manage people unless you saw them had to change their minds, but they found that it worked for them. However, there was also a quick judgment that this is a new business strategy for us, for a lot of companies. And we were talking about way early on, don't make long-term decisions in a fluid, changing environment. What we're finding is that it's not all roses. The romance is gone. The reality is setting in. They're finding a lot of their people's effectiveness is dropping. I'll refer back to Jeff to talk about specifically those different stages in a mass disaster and why we may have seen an elevated productivity and now a drop-off in productivity. The other big thing I'm finding too is that the managers, there are some managers that are doing a real good job at the human side of helping support their people. The majority of managers are struggling, and I hear that from people saying, I'm not getting the support I need. I'm not hearing the feedback I need. I don't know what's happening to my career. And those things are the new kinds of conversations that I'm hearing when I'm coaching people.
Jeff, what are you seeing from your clients?
Well, much of the same thing that Rex has seen as well. When we first get involved in a mass disaster, the sky is falling, and we all respond with, what do we do now? And there's confusion and uncertainty, and our effectiveness just tanks. But then people and resources come together, plans for this kind of thing are dusted off and implemented, and there's a honeymoon phase where we seem to really be taking off and really conquering this thing, and we're at a high because we've gotten the worst behind us, and it looks like we're going to be able to move back into some sort of normalcy. And then reality begins to set in, and we realize, well, there's no such thing as a new normal because there's no normal anymore. What's going to be new is totally different from our expectations, and we get bogged down a little bit, kind of re-entering that grief stage, that confused stage, looking at the future more from a perspective of anticipating now chaos and not order. And then we begin to realize that, yes, this thing isn't going to overwhelm us. We can work ourselves out of this place. We can figure out what to do. We need to create the new future for ourselves and not have unrealistic expectations of what it's going to be like. And that creates a slow climb back to a better place. But the thing that jerks people around emotionally is that early sense of despair, followed by that ambitious, forward-looking, euphoric, we've got this conquered, we're going to make it all work. And then that dash of reality again that, yes, yeah, but it's going to take work and it's going to take time, because mass disasters are processes, not events. And there's not one single event or single cluster of events that's going to fix everything that we need to realign and take care of moving into the brighter future. Probably the thing I'm seeing most from my clients has to do with their personal lives and their work. In their personal lives, they're trying to realign their expectations about the future, managing their own lives, taking responsibility, taking control of what they can in their own lives, and not assuming things are just going to happen. That's a deeper level of personal change than most of us are familiar with, and personal change brings with it stress and concern and risk and anticipation. So on a personal level, I'm finding that the leaders I'm dealing with in industry, and it doesn't matter if it's a $1 billion company or a $100,000 company, they're all struggling with the same personal issues to some degree. Secondly, in terms of their business, they are beginning to understand that change doesn't have to bring stress with it, organizational change, that there are ways that you can implement change that actually can shed stress for the returning workforce, for their employees. But they have to change how they think about the work they do, and that's the bigger change for them. Rex can speak to that here in just a minute.
Let me ask you a question on that, Jeff, because I think there's a lot of people who just assume, we're getting back to normal. Then there's a lot of people that assume a vaccine is going to be the be all and end all, that gets us back to normal. Is that a safe way to think, or, should people be anticipating, the change that's coming and, looking for something different?
I think they should be looking for something different. Now, it will have touches of what is the same and will remain the same in it, but that'll be less visible and less present than a lot of things that are going to change. Vaccines, for example, let's say that we are very fortunate and we actually do have a working vaccine by the end of this year. It's unlikely, but let's say we do. That vaccine has to be tested first in at-risk groups, the infirm, the aged, the marginalized nutritionally. And then they have to roll that out to larger and larger populations, going with the ethnic groups that are most susceptible to COVID-19 first, and then they have to take that out to the population at large. That's a 5 to 6 month process right there, even if we start in November. Then we have to see enough of that successful vaccine distributed globally that statistically we know that at least 50% of the time or better it's going to work, and that lowers the odds of the pandemic being spread, of new hotspots being created. It reduces the incidence of hospitalizations to a point where our healthcare infrastructure can handle it and keep it under control. This new thing that's evolving, we won't even see what the end result is until much later in 2021, and those changes will continue to impact the workplace into 2022. That's a realistic expectation.
Even with that, every business leader, when you go through something like this, one of the contingency plans has to be, what if things don't change? And have that ready to go. And you're right, Bob. I've got some clients thinking we're just going to get through this. What nobody is calculating, the reason we wrote the book, is that there is a hidden mental health crisis coming, regardless of whether you get back to, quote, normal. We've been disrupted permanently, and that emotional processing that has to take place. I mean, there's no avoiding the emotional process of a trauma. Just like physically, you bruise something, you break an arm, there's a process you have to go through. That's what people aren't calculating. They're looking at this as an event. And what I like what Dr. Jernigan talks about, or what Jeff talks about, is that this is an ongoing process that will have waves that you have to anticipate. So that's part of the process. And the work from home side, I mean, what I'm seeing is people's Wi-Fi is not as good, or they're taking care of from home, or they've got a spouse. My daughter and her husband, they have a 1-bedroom apartment with 3 dogs. So he has to go into the bedroom, use the bed as a desk. Physically, that's not that's unhealthy to have to be in that condition. Everybody has been cooped up. We have cabin fever. We're not connecting. I'm seeing people, we use the Clifton Strengths, and it's really clear to see those people that have a lot of the people-oriented strengths, they're hurting. And the people who have more of the kind of internal strengths, they're disappearing because they're going into kind of their cave, their thinking cave, or they're just getting things done. All of this is going on, and it's going on without any real cultivation, nurturing, or management to it. It's a totally new world. Whether we get back to normal in 6 months, a year, or 2 years, it's been permanently changed. And I think you said this is the largest change management experiment in history. Mm-hmm. And that's what we have to look at.
Rex, to your point, managers in the former economy in the U.S. largely were analytical people dealing with numbers. They had to connect with people, supervise people, but it was from the perspective of what the analytics show us. The new breed is going to have a much higher emotional intelligence than the old breed. Going back to your point about stress. When our mind processes stress, it doesn't go into the left side, the logical side, the rational reasoning side, because of its nature. It goes into the limbic region on the right side of the brain, the feeling side of the brain. And so that stress needs to be processed emotionally, and we teach managers how to do that. It's not just enough to rationally say to them, well, get over it and get on with it.
Right.
Because that does not relieve stress, it adds stress. For example, I'm dealing with a lot of employers who don't know how to handle employees that say, well, I'm glad you want me back in the workplace, but I'm going to stay remote. And then when they ask why, they say, because the schools aren't open and I got kids at home. I can't leave them at home and I can't bring them to work with me. What are you going to do about it for me?
It's really exposed the quality of managers. I mean, Gallup already says that less than 20% of people who are currently in management roles are naturally wired or skilled to be good managers in the sense of the social and emotional skills that Jeff was talking about. That was prior to COVID. And we already know that 70% of the workforce is either checked out or toxic. 20% are toxic. Well, those numbers just went up. Now you add the remote side of it, which is what we're talking about in this session. Now you can't see people. So managers were adequate when they could see people and tell them what to do, tell them how to do it, and then follow up and make sure they did it. We call those the babysitter managers. They were competent in that mode. Now that's been taken. And one of the clients that I'm working with, what we suggested for them is that they add a coach, a life work coach, to supplement the manager so that they would have different functions. We're not going to overnight all of a sudden transform people who aren't gifted or skilled in the social emotional side to now be that. So now we're looking at additional roles, a new role that can kind of bridge that gap until the culture begins to shift. And culture shift, Jeff, you can tell me, but 3 to 5 years for major culture shift. We're not calculating that this is the largest change management event in history. And change, as Jeff has talked about, means stress. We have to manage that. We have to model what it looks like. One of the other challenges I'm finding too is managers are working 12, 14 hours a day. They're not modeling resilience. And so their people are going to mirror what they're doing, and they're also working extra or learning how to hide. They're learning how to game the system already. And so it's just a new world, and we've got to learn how to deal with it.
You know, Rex, you've been using health trackers like Whoop, for a while now, and you got me on it. I've got mine, and I track my strain and my recovery. But you've got some interesting data on that. Can you share some of that with us?
Well, a few years ago, when I started using it, I began using the Whoop in 2016. I was getting back into sports. I'm a certified tennis professional that has been out of practice for a long time, but 2016 was a turnaround year, and I started seeing a new trend. First of all, there was this thing called overtraining syndrome that was affecting a lot of athletes, and they were burning out or getting injured. And now I started seeing people like Roger Federer and Tom Brady getting 10 to 12 hours of sleep a night. So I checked into what was going on, and one of the ways they were monitoring that is with trackers, and there's several. There's the Oura Ring, there's the BioStrap, there's the Garmin. But what they measure differently is they measure something called heart rate variability. That's really a measure of resilience. And it also measures the strain or stress that you're taking on. One day I decided to measure a workshop using this. And so I just put it in and tracked it. And when I saw it, I was blown away by the level of strain and the calories that I had burned. In a 2.5 hour keynote with rehearsal, I burned 1,600 calories. Wow. In that time frame. I called Whoop and said, what's going on? And they said that cognitive load and emotional load affect your autonomic nervous system. That is your heart rate, the adrenaline or cortisol in your system, the same as physical effort. So for the last 3 years, we've been tracking that for knowledge workers, people doing presentations on deadlines, and we're finding it's incredible. And so the application here is that we're using more calories than normal. I measured a 2-hour workshop I did on Zoom. I burned 688 calories. Now, if you're not into sports and you don't track, that's in an hour of tennis, I'm burning 450 calories and I'm working hard. So imagine this. So I'm going to turn it over to Jeff because there's some real brain science as to why we're burning so many calories.
Well, first of all, 30% of the energy we need every day is used by the brain. It is the most significant consumer of our energy of anything else in our body. 38 of the 43 nutrients we need every day for life are used exclusively by the brain. The 9 neurotransmitters in our brain that allow the different structures to communicate with one another, allow us to think and reason and feel, those are produced out of the building blocks of what we eat in our stomach. Our body does not manufacture those. So this control center between our ears is the thing we pay the least attention to, but needs the most health care in terms of simply nutrition. The right foods, not the wrong foods, not overeating, not undereating, hydrating, limiting alcohol, all of those things affect our CPU between our ears. And it's easy to get that out of whack. And when that happens, the stress impacts our immunity, lowers it. We're more susceptible to disease. It also affects the operation of our autonomic nervous system. We develop physical and medical conditions as a result. If we're not taking care of our mind can't take care of us. When we exercise, going back to your getting back into sports, there is an enzyme produced in our muscles that flows to our brain through the bloodstream called a brain-derived neurotrophic factor. And it triggers in our mind the repair and replacement of neural pathways in brain cells The challenge, though, is that only happens while we sleep, in that deep, uninterrupted sleep that we have. Imagine your brain as a high-rise office building. At the end of the day, everybody leaves. As the sun goes down, the janitorial staff comes in and cleans up everything, empties the trash, cleans off the mirrors, vacuums the place, and gets it ready for another day of work. That's what the brain-derived neurotrophic factor triggers in our brain while we sleep. So if we have sleep disturbance and we're not getting enough sleep, or we're waking up in a panic and going back to work, then our brain is getting cluttered. And sooner or later, that trash is going to impact our ability to reason, our ability to think, our ability to regulate our emotions and be self-controlled, and lead to that breakdown of this wonderful thing between our ears that controls our whole body and is key to our health.
So Jeff, I'm going to ask you, you were sharing with me, under normal conditions, the brain is using 30% of our calories. But in this new environment, what's the range in terms of calories? Why do we feel so exhausted at the end of the day of doing video conferences, and we think, I didn't do anything, I was just on video conferences all day?
Because at peak times, in terms of your focus and the use of your mind, you can be using 50% of your energy or more directed towards those activities.
Right. And then here's the tie-in. This is a shameless plug for the book, The Healthy Workplace Nudge. But what we found is that stress then leads to unhealthy coping behaviors: overeating comfort food, alcohol, binge watching Netflix, that's the sedentary side, using medication for anxiety or sleep. All of those then interrupt sleep. And then you come back the next day and you have to stimulate your body artificially. So what happens, and what we learned with bands like this, is that a lot of us have become what we call suboptimal. Our bodies have adjusted to not having the energy reserve that we're capable of having. And we think that's the new normal, to the point where we don't even know what normal can feel like anymore. We're so drained and we're so dependent on these stimulating things. If there was one recommendation, and I'll make sure Jeff chimes in on this, that I would make to gain resilience through this whole thing, reduce stress, improve health, is get a full quality good night's sleep. Imagine if everybody in the company for 1 week just got a full good night's sleep, how much better off we would be, how we would handle crisis, how much nicer we would be to work with.
I couldn't agree more with that, Rex. And the challenge is sometimes people self-medicate with over-the-counter or prescription medications because they're not getting enough sleep. And that's a trap. We need to find as many natural ways as possible to influence our sleep, like quit watching blue screens an hour before you go to bed, drink the right tea. The problem we run into is people will wake up in the morning feeling a little depressed and take an antidepressant. Well, when that wears off, the side effect is a little anxiety added to the anxiety they might already have. And so they take an analoxic, an anti-anxiety medication to deal with their anxiety. But the side effect of that medication is, guess what? Depression. That's why you wake up in the morning feeling depressed. And so you're trapped in this cycle
Right.
that really doesn't help your sleep and is deteriorating your mind and your body.
Now, for another webinar, completely off topic, one of the things Jeff's practice does is brain scans. So this stuff actually shows up physiologically on your brain. The things you take, the lack of sleep. When you see the brain scans of somebody who has been sleep deprived or somebody who's been taking Lunesta, over a period of time, or Benadryl, you suddenly say, I don't want to do that. So we'll leave that for another webinar, but it really is telling, and it shows up.
It is dramatic.
Yeah, no, this has been a great discussion, and it's been a lot of fun, learning from you guys about some of the things, the risks associated with work from home. Where can people go to find out more about work from home support?
Professionally, I'm a clinical psychologist, and we have a medical staff helping employers manage the workplace and the employee workforce in healthier ways, mental health ways. We are glad to be a resource for organizations in that respect. I am not in private practice anymore, so most of my consulting is with organizations and individuals, but we can refer individuals to well-trained, well-qualified people to help them manage a mental health condition they're struggling with during this time.
People can reach my organization at rexmiller.com. And some of the things we're using, for example, we're using the Clifton Strengths to help people know how to play to their strengths, because there's an intrinsic rejuvenation. There's dopamine and endorphins that take place when you play to what you're naturally wired to do best. We're also working with teams in a process called peer-to-peer support. That's some of the work that Jeff's organization has developed to help managers help their people work through processing the experiences that they've been having. That is in the book. We've got a whole section in the book. And again, we'll provide a link for people to get copies of the book, either the free overview, the printed version, or the digital version. We'll provide links for that. And your audience will get a discount on that. We'll have that as well.
Thanks, Rex. I gave all that nice information without a means of contacting me. You can reach me at thehiddenvaluegroup.com.
Gentlemen, thank you very much. It sounds like I'm going to have to cut back on the beer and chocolate chip cookies. This has been a great discussion. We're finishing up part 2. I'll look forward to chatting with you guys again in part 3. So thank you very much.
Thanks
Yeah,
again,
you're welcome,
Bob.
Bob. Take care.